Welcome back. I am Dr. Lisa Hernandez, and this is Your Health radio and television program. We have been talking today about sexually transmitted diseases. April is Sexually Transmitted Disease Awareness Month, and we've spoken so far to two experts on getting more information about how sexually transmitted diseases affect the community here in Monterey County, as well as what some of the signs and symptoms are about sexually transmitted disease. My next guest is Emily Sciolto, who is the HIV/AIDS coordinator for Monterey County. She has been very active in the last few years with HIV/AIDS programs in the community, and she's also an expert on how to get that information about HIV/AIDS and sexually transmitted diseases out into the community using modern technology such as the internet and texting. So Emily, thank you very much for being here today. I know your schedule is busy as well.
Of course, thank you for having me, Dr. Hernandez.
So as I mentioned, we've talked about testing, we've talked about surveillance and how many STDs are here in the community and in the nation. We've talked a little bit about signs and symptoms. So let's talk a little bit about testing. How can you get tested? Who needs to get tested? So first question, who should get tested for sexually transmitted disease?
Folks that should get tested for an STD are those having unprotected sex, folks using injection drugs or injection drug equipment, or anyone whose partners are doing either of those things, or whose partners' partners are doing any of those things. Does that make sense?
Yeah.
It
can get a little complicated, but I think one of the first things you said is that anyone who's having unprotected sex.
Correct.
So I think the new campaign since the last 3 or 4 years through the Centers for Disease Control and Prevention have been that everyone should be tested for sexually transmitted diseases, especially HIV, at least once in their lifetime, because we don't know, as we've heard before, that some people, that you may or may not have a sexually transmitted disease because the symptoms aren't always so obvious. So you did point out the most important people that need to get it because they are at highest risk for either getting a sexually transmitted disease or giving it to other people. So which sexually transmitted diseases should people get tested for? Should everyone just run to the doctor tomorrow and get tested for everything?
Well, if they feel that there's a need to do so. I feel that, as Linda mentioned, the previous guest, that you know your body the best. If you see anything unusual, any sores in the genital area, or perhaps if you know that your partner perhaps has an STD or HIV, if there's unusual things coming out of the vagina or the penis, then perhaps you should contact your provider, or I can talk a little bit later about how to locate an STD testing or an HIV testing clinic location, or just a place to go to get these tests.
So what about if you do think that you might have sexually transmitted disease or were exposed to someone who has a sexually transmitted disease? What happens when you go to a clinic or to your provider? How do they test you?
Well, I'd say, first of all, the most important thing to know when you're going to see your doctor or your provider, whomever, is just to be as honest as you can with them, because then they'll let you know from that information that you give them, they'll know then what STDs you're at risk for and what you should be tested for. And having said that, there's a couple different ways that they can evaluate that situation. So there's the physical examination, where ladies and gentlemen, will be right back, go ahead and put on this little smock that they give you. They could take a urine sample or a blood sample. So it's really up to them what they decide, but that information comes from what you tell them. So.
And you mentioned a urine sample, which is different than I think people might have remembered in the past in terms of getting tested. I remember that some of the only ways to learn about certain infections like a gonorrhea or a chlamydial infection is that you would have to get an uncomfortable physical exam. And we won't go any farther than that, but nowadays in an effort to kind of increase the chances for people to get tested, there's new ways to be tested for gonorrhea and chlamydia. Is that, how does that happen?
Well, the urine test is the one that I think you're mentioning,
Yes.
or you're speaking of, and it's really very simple. It can be done. It's much better than the lengthy pelvic examinations or other physical examinations that you're mentioning, because it can be done pretty much anywhere.
Yeah.
And that sample can be kept and tightened up and taken to the laboratory. So.
Great. Well, that's nice to know. I think it's one of the things that we want to do here today is kind of get rid of some of the myths that being tested for some of the sexually transmitted diseases can be uncomfortable, whether it's because you have to go into the doctor's office or whether you have to have an uncomfortable exam. This way, there are other places where you can get tested where you may feel more comfortable getting tested. So you mentioned, I know we'll talk a little bit later about some of the resources of how you can find out where you can get tested, but what are some of the places that you can get tested here in Monterey County?
Well, there are a couple, and then I'll also mention a way to find out where they all are located. So first you can contact, I'd say go online and visit any Planned Parenthood website, Planned Parenthood Marmonte. You can go to any of the clinics there. There's a few in Salinas, and they're actually spread out pretty well throughout the county. Also, the health department clinic at Laurel in Salinas, and then also at Alisale, as well as Seaside on Hillby Avenue, or I believe it's Fremont actually, here in Monterey County. Those are a couple locations that you can go to, or as well as you mentioned earlier about the CDC, you can go on their website and type in your zip code, and you'll be able to locate some of the nearest clinics towards you. And you mentioned the GYT campaign, and that's something that I just like to mention. It stands for Get Yourself Tested or Get Yourself Talking, and that there's a website there as well. It's www.gytnow.org, all one word, gytnow.org. And there as well you can type in your zip code, and it'll come back with a list of local clinics to go get an STD test.
So that's what that pink button is.
It is what the pink button is. Thanks for noticing.
Yes. And so what else is part of that campaign?
There's a handful. This is an all-year campaign. Partners of CDC include MTV, Music Television, Kaiser Family Foundation, as well as Planned Parenthood Foundation, and other partners as well. But they are running the campaign all year long and really emphasizing the activities this month in lieu of STD Awareness Month. So there's other things like this handy Taking a Sexual History guidebook for clinicians, and the website also boasts other information about all the different STDs, as you can see here, like we heard about from previous guests. There's a lot of good stuff there. And also locally, we do have the Postponed Teenage Pregnancy Prevention Program, and this is a card here good for a free gift card to Target or a King City movie theater pass if you get an STD test or you go to any one of the clinics that are listed here on this card. For another handful of reasons, you're able to get those incentive items. So.
Great.
There's a few more locations on the card, and the card can be found anywhere throughout the county and on the website at the County Health Department website and most of the county clinics. So
great. Well, it sounds like there's a lot of information out there. So let's say a person has found a clinic that they're going to get tested for sexually transmitted disease, and they get tested. What happens with those results? We know that the visit is confidential, but so that if someone calls in and wants to find out if I've been at say it was me, if I went to the doctor's office or clinic, they can't say. But what happens to that information results when it's in the doctor's office? Is that protected too?
That information is protected. Most everything that happens inside a clinic setting or at one of these locations that we're mentioning is 100% confidential. And I say most everything because results, as Christy mentioned, the first guest, some results for some STDs are then forwarded on to the state for just reporting purposes. No name or anything like that is attached to these results. It's just a general count is forwarded onto the state from the local health department or local health jurisdiction.
So how would I get the results of my test?
Well, there's a couple different ways that clinics go about delivering the result. They, if it's something that you can get your result immediately for, you'll already be there. If it's not, they'll hopefully schedule a return appointment for you so you can come back and they can kind of discuss things over with you, results, treatment, recommendations, etc. Or it'll come in the form of a phone call. You give them, the number that you'd like them to contact, and there's mechanisms in place to assure that you're the one that's going to be receiving the result only. So if you're over 18, that's pretty much taken care of already. If you're under 18, there are still ways that clinicians and other folks can go about making sure that you're the only one that receives the result, not a parent, not a guardian, not anyone but you.
Great, thank you very much. So another burning question that people ask, how much does this cost?
Well, that is a good question, and it really ranges. Anywhere from free to and sliding scale to, as Linda mentioned, family packed, or private insurance. It definitely just depends on the clinic setting. So the recommendation there would be to call ahead and see if you need to schedule an appointment, and then you can inquire about those cost issues.
And the other point is that if you call your first clinic and the expense is too much for you to handle, keep checking. Because there are places where you can get tested either for a manageable amount or programs such as Family Pack, so that you can get tested and treated without having to pay more than you can ever handle or pay at all. So that's really important.
You could shop around.
So as I mentioned, you're HIV/AIDS coordinator for the county. So that is a topic that you are #1 expert here. So I want to take some time to kind of get all the information about HIV/AIDS out to our viewers here. So what is HIV and what is AIDS? We always call these illnesses by those names, but what are the diseases?
Well, HIV is acquired immunodeficiency virus, human immunodeficiency virus, and AIDS is acquired immunodeficiency virus. So, acquired immunodeficiency syndrome. And what happens here is there's AIDS is a more progressed stage of HIV, and the ways to get HIV there's 5 different ways that we typically speak of to get HIV, and they're all bodily fluids. It's transmitted through bodily fluids. There's pre-cum, cum. There is vaginal secretions, as well as blood, and then from mother to child during the birthing process.
So kind of the similar risk for transmission as the other STDs that we talked about already.
Correct, and it's chronic, it's viral, like Linda mentioned. There are treatments, and there are various ways to go about managing the treatments, and antiretroviral drugs that you can use or that you can take as prescribed by your doctor or clinician, and those are the ways that you can kind of maintain HIV or AIDS or AIDS.
So who should be tested for HIV? And how often should you get tested? Is there a recommendation on that?
The recommendation is testing is a method of prevention, but shouldn't be something that someone is engaging in frequently. Because that would mean that you're frequently putting yourself at risk for HIV, and that, of course, is something that we work to try to prohibit. And so, testing for HIV, you can get tested. The reasons to get tested are very similar to STDs. So anyone who is having unprotected sex or using injection drugs or injection drug equipment, and anyone who knows their partner is engaging in either of those behaviors. So I believe the other part of your question was how often?
How often?
So again, there's very few symptoms associated with HIV, so it would be difficult to kind of self-diagnose and think that maybe you have it, because just like STDs, the most common symptom is there are no symptoms. So folks that are getting tested for HIV should remember that antibodies for HIV typically do not show up within one's system until after 2 weeks from the date of the infection or the supposed infection, all the way up until 6 months, with most folks showing antibodies for HIV after 3 months. So in short, the answer would be about 2 weeks or more after the date of the supposed infection.
And it sounds like then you may want to
follow up.
And that's something that your healthcare provider or the clinic will make sure that you know. But it's important to keep that in mind, that it's not just one test, that you need to most likely have 2 tests for that. So we talked about how often you need to get tested, who needs to get tested, and how do you get tested? What is an HIV test like? Is it blood? Is it urine? Is it a pelvic exam?
There's a few different ways, just like STDs, or the most common STDs. HIV, you can be tested, of course, you can get your blood drawn, and it'll go to the lab. You can do what's called, one of the big manufacturers of HIV tests is OraSure Technologies, and they do a OraSure test, which is a saliva test, right around the inside of your mouth area. Or there's a rapid test, which is also saliva, but the way that sample is collected is a little bit differently. The OraSure, which you will not get your result until about two weeks after you take the test, that collection device is just kind of held here on the side of your cheek. It's a cheek swab. And then the OraQuick, which you'll get your result in about 20 minutes after you take the sample, the collection device, and kind of swab it around the inside of your mouth, and some saliva gets on that little collection device, and then it's only about 20 minutes until you get your result. So saliva, blood, cheek swab, I can't think of anything else.
So with those OraQuick and the OraSure test, who does the test? Can I do that at home, or is that also in a doctor's office or clinic?
It's also in a doctor's office or clinic or other setting throughout the community. There are a few other settings that you can get an HIV test from. And here in Monterey County, I can at least tell you that there are a number of locations that you can get the rapid HIV test. So the results in 20 minutes.
Great. And what about the link between HIV and other sexually transmitted diseases? Is there one?
There certainly is. I believe Christy touched on that, the first guest, very briefly. And the connection, to make it as easily understandable as possible, is if you have HIV or if you have an STD, it's much easier to get if you have HIV, it's much easier to get an STD. If you have an STD, then it's much easier to get HIV than not. And then, of course, if you're co-infected, if you have both, then you're really opening the doors there for a third one or other complications that may be associated with having HIV or STDs.
So it sounds like if you're getting tested for a sexually transmitted disease, you should ask for an HIV test if your provider doesn't offer it to you. Or if your provider offers it to you, you need to take that opportunity to get tested, and vice versa. If you're getting tested for HIV, that your provider should be testing you for the other sexually transmitted diseases depending on what your risk factors are, and you should take that opportunity to get tested.
Indeed, like I mentioned earlier, the honesty is the best policy when it comes to this, and that's definitely something that this GYT campaign, Get Yourself Tested campaign, is really tries to communicate to the community. Be as honest as possible with your provider.
Well, thank you so much, Emily. It was very important for you to give us the information about sexually transmitted diseases, especially HIV. I appreciate the audience for listening in to learn more about sexually transmitted diseases. As I mentioned earlier, next month we'll be talking about traffic safety, and we welcome your questions through our website or our email address, which is mchd2010@gmail.com.